on environmental health, and probably dwelt in one page that we are going to recruit or deploy community health workers. So I think instead, in my humble view, instead of building into primary health care, it is like telling us, if you have community health promoters, you have primary health care. I'm sorry. That is not that's not the case.
That's not the case, and it's quite concerning.
Yes.
Because I think ama tueleze Mkenya what is the work of that community health promoter according to what is in the act.
A community health promoter is also not a new thing. We have had community health workers almost everywhere. As I told you when I gave you an introduction of myself, I have worked in refugee camps in many settings in Africa. In East Africa, in Southern Africa, in Asia, and some other parts of the world. And we do have community health workers. We used to recruit community health workers. But the work of a community health worker is a mobilizer. It's to mobilize the community and help them go and seek health care. But right now, my challenge with this bill is when it seeks to promote community health or elevate community health workers as the very key of primary health care. Is, the community health worker is the lowest rank of health workers. I would have liked the bill to discuss in a health facility, we have in a dispensary, we have 4 nurses, supported by 10 community health workers. In a health center, we have 10 nurses, 1 midwife, 1 clinical officer, 1 whatever, and they provide this range of services. And they are supported by so many people or community health workers. But the act itself, the only worker it recognizes in the healthcare setting is the community health worker. I'm sorry, I don't know how things are expected to work. I'm not sure.
This is quite concerning, and from my layman's point of view, according to how daktari ameeleza hiyo maneno, ni kama kwamba tunapewa socialites wa health. Okay. Ni kama tunaamua tu kukwambia, oh, you need to go to the hospital, unahitaji kwenda kuona daktari fulani nini, and those are the people we are being told are going to help towards primary health care. Wewe kama Mkenya, si ukigonjeka unajua wewe ni mgonjwa, si unajua ni wapi kuna hospitali. Haja gani ukuwe na mtu wa kukwambia enda hospitali, umegonjeka enda hospitali, na akuwe ni yeye ndio anapewa more focus as opposed to ule mwenye anaenda kukutibu. Tukisha kutoa nyumbani tukupeleke hospitali, utapata aje matibabu kama hakuna dawa za kukutibu, kama hakuna daktari wa kukutibu? Uko tu na mtu wa kukwambia, oh, you will be healthy, go to the hospital and do that. It's like we are promoting socialites as wow.
I wouldn't call them socialites, but I think it is a misplaced effort.
Yes. Okay.
We are doing something that we needed to focus and say, how are these units going to run?
Yes.
If you look at the budget that is allocated to primary healthcare facilities, it's a very small budget compared to the national health budget.
Yes.
40% or 45% actually of our national health budget goes to tertiary institutions. Then the rest is divided
between all these other levels of
all these other levels, level 5, level 4, level whatever. By the time you get to primary health care facilities, the budget as it is today, they are getting less than 4% of the national health budget. And this is where we need to put a significant portion of our resources. You know, the units, the primary healthcare network is supposed to be treating or managing several very important conditions like diarrhea, malaria, immunization, antenatal care, treatment of or vaccination, environmental sanitation,
yes.
Health education, food and nutrition. These are the key components of primary health care. How well we are doing in those providing that health care will impact healthcare at a higher level, because if you prevent, let's say, complications, if you vaccinate a child, you prevent measles. If you prevent measles, you prevent things like, let's say, malnutrition. You prevent infection of the ear. Because many of the children with measles will develop something we call otitis media. We have seen uzao ukitoka kwa masikio. Those are the children who will eventually end up in tertiary hospitals and with ENT surgeons to be corrected those deformities. But we could have prevented them
from the word go.
If you look at our own development, if we are able to make sure that children are not, don't suffer all these many infectious diseases, those children could have grown up healthier, become with realized their genetic potential, have good mental ability, become professors, doctors, and what. But when we are repeatedly suffering from this condition and that condition and that condition, they have deformities, they don't realize their genetic potential. The country has, I don't want to say a poor stock of human beings, but eventually we'll have a group of people who do not realize their genetic potential. And forgive me if I use poor stock of people, because they have been ravaged by disease at a young age.
Wow. This is so intense. And a question to my leaders. When you are signing on those apps, do you really understand them? And if you understand them, if you don't understand them, who actually explains them to you? Ni nani anakuambia they are the best? And what can we do to rectify what has been wrong? Na kwa Mkenya, na wewe, what are you doing to ensure that you get the best leaders to actually support you, to actually care for you? And we have seen how important primary health care is. But primary health care is not only community
health workers, yes. I have found that.
And I think back in the day, it is when it was very important to have these community health workers, because I remember back in the day with our backwardness and all that, we used to believe there is no need for you to go to the hospital. There may be some things you can just treat them privately and all that. So, but over the years, our mind has shifted from that particular way of thinking. And
Yeah.
now we understand the importance of the hospitals and why we really need to seek medical attention. Is that right?
You know, a community health worker is an effort that is not the best option that you can have. Because you pick somebody from the community, you give him 3 or 4 days of training, or a week of training, and then you push him to the community to do something, to mobilize people to seek health care. For instance, when I was in medical school, in 1981, we were about 100 medical students in the whole of this country. Currently, we are producing about 1,500 graduates, medical graduates every year. We have done well. We have so many clinical officers who are unemployed. We have so many nurses who are unemployed. We have several cadres of nurses. Okay? We have got what we call registered community nurses. Those should be right at the bottom of the community. They are the ones who should be mobilizing the community. They are trained in key aspects, like if they came to your place, they would be able to do your blood pressure, they would be able to take your blood sugar, they would be able to examine a pregnant woman, they would be able to detect minor illnesses, they would give treatment. Those are the people we should be deploying in the villages.
Yes.
They are there,
Yes.
but we are not employing them. I'm not saying they are sufficient, but why would you use the word backward? We have an improved cadre of health workers who are not really employed. Why would we be getting a villager and paying him 5,000? Why not employ this community health worker? Give him that 1,000, so he covers 10,000 or 5,000 families. So instead of one community health worker, you can have one community health nurse. Instead of
maybe 10 or 20
yes,
community health workers, you have one.
you have one. Give him or her a motorbike,
Yes.
and she can visit all those. Why are we wasting resources? I would say it is a very poor strategy. Yeah, I think we need to think a little bit, look at our human resource. We have developed quite well. We have a lot of health workers, and maybe look at how many community health nurses do we have in this country. I don't know. Can institutions train them? Can we give them motorbikes? Can we do something more? Instead of deploying people, just, I don't know, probably will be political appointees, and MCAs will appoint their brothers and sisters and friends. Yeah.
This is quite concerning. Lakini kama wewe Mkenya, what are you doing and how do you think we can now forge the way forward? What Dr. is sharing here with us is very important, and we can see the thought process and why it is important to actually have informed policies, informed acts that are actually going to save us kama wa Kenya, sindio? We want to achieve or realize the dream of primary health care.
Yes.
And we can only realize it if we have informed decisions.
Yes.
Wow. So before we continue with this discussion, last time jua ilikuwa inatupiga, but we are still here. Hatujatoroka, jua ilitupiga. And if you are liking this conversation, subscribe. Hit the subscribe button. Unaweza gonga your bell so that next time when we have an episode, you are notified. Karibu sana Afya Yetu podcast. And let's proceed, Daktari. So what do you think can be done to actually realize the dream of primary health care?
I think let me probably discuss the plus, the positives that we have towards that realization. It is possible. We have over 6,000 primary healthcare units scattered across this country. They may not be evenly distributed according to the population, but I believe that you'll be able to pop in a primary healthcare facility within 5 kilometers, within 10 kilometers, you'll be able to find one. Maybe in some very difficult areas, like maybe like northeastern, where the RAD is vast and the population density is not high, you'll not be able to find a health center within those whatever. We need to employ the right people with adequate skills for the job they are supposed to perform. We need to supply those facilities with the required supplies or commodities. We need to link them to the next level so that if a patient comes or if a client comes to a dispensary and the nurse recognizes, I'm not able to handle this person, they would be easily able to refer him or her to the next facility, which is 10 kilometers away. And if the person goes there and finds that that facility, you still they cannot deal with their problem, then you approach to the sub-district or level 4 hospital. So that link needs to be created, and we need to make sure that these facilities that we are talking about, we define their roles very clearly, their responsibilities, and for each role and responsibility, we attach a budget and a person to do. So that we know if it is environmental sanitation, who is looking at our latrine coverage within, how do we dispose our human waste in that community? How do we deal with that? Because that's one of the biggest problems. If it is pregnant women, who is seeing them when they come for antenatal care? Is the nurse always there? Is there always somebody there to see pregnant women when they come and they refer them to higher level? And then we also need to make sure that when these people are coming to these clinics, as the government says, it is free. It is free, but remember that when people discuss things which are free, may not be necessarily free. I may have walked for 10 kilometers to come to a health center. I may have gotten a bike to come to the health center. But those are costs that I can manage as an individual. But when I come to the health center, it is critical that I'm not told, go and buy, we don't have that vaccine today, come next week. because it means I have to go home, and next week I have to come back. I have legal resources. It's not possible for me to go home and come back next week. It should be that nobody tells me, go and buy that medicine in that pharmacy. Or first of all, go to that clinic, and then I'll see you there, and then bring you back to this clinic. It should be free because everybody is working for the betterment of the clients who seek health care in that primary health facility. And, the biggest responsibility for the county government is to provide primary health care. And I wish they took that responsibility seriously. Provide a very good, accessible primary health care. They would do this country a lot of good.
Wow. You as the leader, you as the person in charge of supplying these medicines, you as the person in charge of stocking these hospitals, what is your role in ensuring that our hospitals are fully stocked and fully equipped to actually treat the ailments of the people we are serving?
Thank you for watching Afia Yetu, your healthcare podcast. Like, subscribe, and comment. Watch out for episode 3.